Breastfeeding is overall awesome, and it has a host of benefits for both mother, baby, and our communities. Breastfeeding protects the mother from a variety of things instantly after birth, like postpartum depression and postpartum hemorrhage, but it also protects mother from a lifetime of issues. Some of those are things like osteoporosis and arthritis. This act of breastfeeding protects the mother long term. Breastfeeding does a lot of subtle things that is hard to see under the surface, like reducing the release of the stress hormone. Breastfeeding usually helps mothers sleep better, which seems like an oxymoron because it's harder for other people to feed the baby during the night and everything. But overall, since you can rest while you're breastfeeding better than preparing a bottle, feeding the baby, burping the baby, all these things that you have to do that you don't have to do if you're breastfeeding, causes less work for the mom overall. And baby sleeps better, family sleeps better, and so everybody is overall more rested. And of course we know that breastfeeding benefits babies. It lowers their risks for a lot of lifetime issues like child diabetes, allergies, ear infections, fevers, sudden infant death syndrome, and even like things that you wouldn't think would be related, like speech difficulties later in life. It lowers their risk for a lot of lifetime issues, some as big as cancer. And it's easy to see that when we are benefiting people on individual levels that improve their health overall, it's going to improve our community's health. Diseases place big burdens on communities, financially, physically, emotionally, mentally. Children who are left childless because of disease, people who need financial assistance because of disease, people who are unable to perform at work because of disease. Like, lowering families' risks of these things help our community overall. And of course, when we have communities that are stronger, this just makes a stronger world overall, if all of us join in being impactful through health choices. And of course, if communities, families, individuals are all benefiting, then of course care providers are also benefiting because their patients will be healthier. So because breastfeeding is so important for the individuals and the families and the communities and the care providers, we should all work as a group and a team to help encourage breastfeeding. And now I hope you don't misunderstand that this does not mean guilting people into breastfeeding or telling them that this is the best choice for you and so this is what you need to do. That's not what I mean at all. Because there are some families who, for whatever reason, breastfeeding is not the best option for them. And I don't mean just situations where the mom can't breastfeed. I mean there are situations where breastfeeding causes more stress than it alleviates. This can be true for many moms who are returning to work, and pumping just becomes such a drain on their physical body that it's causing them to not be able to perform as well as a mother and as a person, as an employee. And it's just, ultimately, it may not be worth it for those people. And we understand that. This is not about guilting, this is not about pressuring. This is what the science says. And so if it's possible to breastfeed, let's encourage it as much as we can. I think that if we all join in that mindset of being encouragers of breastfeeding, then there will be more openness and more willingness to explore the possibility of breastfeeding. Supporting breastfeeding can look a variety of different ways. One of the main ways is being breastfeeding educated, which you're doing through this course. I encourage you to share it with other people so that they can become breastfeeding educated too. And this is amazing because it's not just for people who are actively breastfeeding. This is for people who may know someone is breastfeeding. Grandmothers, aunts, uncles, siblings, friends, even leaders in places like churches and doctors' offices. Becoming generally breastfeeding smart can make you a better supporter of breastfeeding overall, and it can make your environment better to encourage other people to breastfeed and make choices that improve our communities. Now, of course, that encouragement and openness and knowledge about breastfeeding is the main step towards making breastfeeding more common in our society. Another way you can support breastfeeding is being aware of a breastfeeding woman's rights. There are some people who think that women are not allowed to openly breastfeed in public, and that's just not true. They are protected in almost every state to openly breastfeed if that's what they choose to do. So being willing to understand that she has the right to do that is important, but also being willing to understand that some women want privacy for whatever reason to breastfeed more discreetly. And that can be really difficult with an infant and a cover in public places or in private settings. So if you have a breastfeeding person in your customer basis, in your congregation of your church, or in your family, try to find ways to create safe environments for them to discreetly breastfeed. that does not interfere or cause a lot of fuss or draw a lot of attention. Make it just readily available for them. And that will encourage breastfeeding and help extend breastfeeding in your communities, because sometimes women choose to stop breastfeeding, families choose to stop breastfeeding because those little things just become burdensome. Trying to find a place to breastfeed, worrying that someone's going to criticize for how they are breastfeeding is very, very discouraging and can be exhausting on top of everything else that you're dealing with as a new parent. So try to be as supportive as you can in creating environments that are comfortable for them, no matter how they choose to breastfeed. So to summarize, I made this video public. So this is not a private video through the course, this is a public video. So I encourage you to share it with your friends and family and help everybody get the general knowledge that we don't want to shame anybody, we don't want to guilt anybody, we don't want to pressure anybody. But breastfeeding is awesome. And so as many people as we can get to breastfeed, the better for our communities. And the more people who can breastfeed and choose to breastfeed, that will help ease the burden for the families that are not able to breastfeed for whatever reason. For instance, I was a work-from-home mom with both of my kids when I was breastfeeding. And so I didn't feel pressured, but I did feel a sense of pride and honor that because my situation was so perfect for breastfeeding, it was nice that I got to carry that burden for our community, whereas some women aren't able to because of their work situation or their health situation or their baby's health situation or other situations that make breastfeeding difficult or impossible. Also, don't forget, encourage, be informed, and create safe spaces for our breastfeeding, for our families, for our communities, for the world. Before I close off this video, I just want to say that every drop of breast milk counts. So when we're talking about breast milk and breastfeeding, protecting environments and protecting families and protecting people and protecting the world, we're not talking about a specific amount. I'm not saying that if you breastfeed for 4 years, that improves your community. Or if you breastfeed for a year, then that protects your community or whatever. I'm saying that if you give your baby 1 drop of breast milk, then that benefits your family, that benefits your baby, that benefits your community. There is no specific amount. Any little amount counts because breast milk is literally liquid gold, and we're going to talk more about that later in the course. But thank you. See you next video.